The program is Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. For effective implementation of health insurance in Nigeria and bearing in mind the limited funds involved, the NHIA is making sure it delivers on its mandate by maximizing opportunities to provide the best care for enrollees. One major mechanism being used is a strategic care purchasing. This enables the authority manage the funds pulled from enrollees wisely while making sure enrollees get quality care. Yakubu Agada Amade, the General Manager, Standards and Quality Assurance Department of the NHIA, provides an insight in an interview coming up in the course of the program. News from around the health insurance ecospace alongside other segments completes the program this evening. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, Anambra State records high enrollment in the informal sector, just as Adamawa accredits more facilities for seamless implementation. Details in our first segment. Keep watching.
The Executive Secretary of Anambra State Health Insurance Agency, NHIA, says informal sector enrollment into the Anambra Health Insurance Scheme has reached 65,000 since coming into effect in 2017. Dr. Simeon Onyemachi made this known at a media parley. According to him, the informal sector of the agency was the highest paying for health insurance anywhere in Nigeria, and this has made the scheme in the state most patronized by informal sector. Onyemachi also said that NHIA has about 250 healthcare providers across the state and that they are being closely monitored and sanctioned where and when necessary in the event of a breach of contract. In a related development, the Executive Secretary, Adamawa State Contributory Management Agency, Dr. Ojudu Amos, has said the scheme in the state has enrolled 23,000 persons. In an interview in Yola, Amos said 56% of the enrollees registered with the public facilities, while 44% with private facilities. He added that the scheme has accredited 310 healthcare providers to provide healthcare services to enrollees, adding that 226 were primary healthcare facilities to fast-track effective implementation of the program.
The program is Easy Access to Healthcare for All. The attainment of universal health coverage is a major mandate of the NHIA, and one major way the scheme can fulfill this mandate is through strategic healthcare purchasing. Strategic purchasing relates to how health services are paid for the delivery of services. In this episode, Dr. Yakubu Agada Amade speaks on what NHIA is doing in this area of purchasing care. Please don't go away.
The NHIA is the foremost agency in implementing social health insurance in Nigeria. It is intended to be the veritable vehicle through which Nigeria can attain universal health coverage. Health insurance thrives on pooled funds. But how are these pooled funds managed so that the authority can fulfill its mandate of giving every Nigerian care at an affordable rate? And who pays for the people who cannot contribute for themselves? Strategic purchasing of care is a mechanism that will allow for better implementation of health insurance. Dr. Yakubu Agada Amade, General Manager, Standards and Quality Assurance, sheds light on this.
Strategic purchasing is ensuring that what you are buying for your enrollees is of good quality, and secondly, that you are buying at a price that is at advantage to your enrollees, and also that the little money you are having, you are using it to buy a lot of services, and also that the services you are purchasing are purchased at the lowest possible and appropriate price.
The health insurance scheme is created to ensure Nigerians have access to needed care, which could be promotive, preventive, curative, and rehabilitative. The authority is exploring how this can be done to the advantage of the enrollees.
Yes, it comes with a lot of benefits. So with strategic purchasing, like I said earlier, you're ensuring the quality of care. You're able to negotiate with providers to be able to obtain the appropriate price for the services and the product. Product includes things like medicine and other things. So if you don't negotiate properly, what you will have is that you could be paying too much. And also, if you don't negotiate properly, it is possible that you're underpaying. And if you're underpaying, the problem you run into is that you don't have providers that will be able to continue to provide care. So that strategic purchasing is important to limit waste and to ensure that there is an agreement between the purchaser, in this case the NHIA and the state social health insurance agencies, the HMOs, and on one side, and the providers who are like the hospitals, the primary health centers and all that on the other side, that there is a negotiation, there is an agreement in the cost, and all that comes to bear finally on the quality of care that is given to the enrollee.
The mandate of the National Health Insurance Authority is the attainment of universal health coverage, and strategic purchasing is a foremost means to achieving that.
For me, we have a mandatory health insurance law in Nigeria, but like I tell people, there is need for people to test and see that it is good. A good product markets itself. So if the services you are giving to our enrollee is good enough, the marketing is already done. Because people who are already on the scheme can go out and on the program can go out and market it to others, and then it becomes easy to implement the mandatory health insurance. So it will help us a lot that we have mandatory law, but it will help us better that one, we are purchasing strategically, and secondly, the quality of care is so good that people will be talking about.
Mr. Agada speaks more about what the NHIA is doing to certify that it is procuring care strategically for its enrollees.
The first one I want to talk about is quality of care, quality management. So NHIS does this at the different levels of levels. One, before you come in, there is accreditation that is performed, and that accreditation as a healthcare facility is to ensure that you have the right equipment, you have the right processes, and that your outcome will be good enough when you are in panels to provide care. That's why today you have some hospitals in Nigeria that are NHIA accredited, and there are other ones that are not accredited. When you feel as a hospital that you are up to the standard that will be accredited by NHIA, you would apply to the NHIA and then they will accredit you. And from time to time, we do what we call re-accreditation. And that re-accreditation will ensure that what the standard you met about 2-3 years ago, that you still have that standard to continue. The other thing we do again is what we call quality assurance. That's the name we use. But technically, quality assurance is quality assessment and quality improvement. So you assess and then you advise for improvement. So, but what we call quality assurance here is that we go around and periodic monitoring, even before the next reaccreditation, to ensure that you are keeping to the agreed standard. So that is their quality improvement. On the other side is to say that yes, we have done quality assessment, we have done what we call accreditation, we have done what we call quality assurance, we have discovered some gap, and then we can sit down with the hospital, develop a plan, a quality improvement plan, and then see how we can improve the services that is delivered to the enrollees. So that is in the area of quality. Apart from these specific ones, we also hold meetings with providers from time to time to ensure that they are keeping to the thing. We share guidelines, operational guidelines.
Quite a number of procedures are also being checked by the NHIA to make sure Nigerians benefit from health insurance.
We are also doing a lot of things in the area of processes. So for processes, we have just developed a standard treatment guideline and referral protocol, which will guide people as per what to do in certain cases. The WHO is currently helping us to do some reviews concerning that, so very soon that will be out. We are hoping that that will generally manage the processes. We also have what we call the health technology assessment, and that will help us to also purchase strategically. Some of the drugs that we have, do we need to add other ones? And if there are new drugs in the market, under benefit package design, you don't just bring them. Because when you look at it, everything in this world now is based on opportunity cost. So the money we have, we can use it to purchase something, but if we have used it to purchase something, we can't use that very money to go and purchase another thing. So there are options, there is scale of preference. So health technology assessment teaches you to be able to say, okay, we don't need this one. This is the one. If I have drug A may be more effective, I will look at the cost. If it's far more expensive than drug B and it's not so much more effective but far more expensive, you can compare the two. It's a science that tells you that yes, it's cost effective to do this, it's not cost effective to do that.
Topping these processes is the uniform tariff system that also ensures proper management of the pool of funds by the authority.
Another way we are ensuring that our enrollees' resources are not wasted is that we do what we call uniform tariff system. So all across the country, we have a common tariff, and that common tariff is derived from negotiation, going to hospitals and getting the prices that they have, and coming to sit down and doing a national we do a national survey, and then we are able to sit down and we compile everything and find the means across zones, across geopolitical zones, across states, geopolitical zone, and the federal. We are having issues with that. We need to do that more frequently because of the prevailing inflation and all that in the society, but we are working on that. We also have issues of benefit package design, which is uniform for everybody under social health insurance, and that is also helping us to contain how we spend our money. Finally, the NHIA Medicine Supply Initiative has also come on board. We have already started what we call the cost sharing aspect of it, which is helping us to bring down the cost of buying some of the more expensive biologics and cancer drugs. And we are negotiating with pharmaceutical companies to bring down the cost, what it will cost to our enrollees to have access to cancer medicine. Maybe in the future we can talk of organ transplant and all that one day.
The National Health Insurance Authority is working assiduously to see that it delivers on its mandate, especially in the area of cost purchasing, to make health accessible at an affordable rate for Nigerians.
Welcome back. The program Easy Access continues with our stakeholders segment, and this evening we shall be talking with the head of the Kano branch of HCL International, a health maintenance organization. HCL International has been in the business of health insurance for decades and runs several programs. According to Aisha Bajasan, who heads the Kano office, NHIA is an initiative that can help strengthen the nation's healthcare system.
The health system in Nigeria is actually poor, if we want to say, but with scheme like this, we can get to where we want so that people don't have to travel out to get health care. NHIA is a beautiful scheme because, like I said, to achieve universal health coverage, that's the only way we can go about it, because nobody can bring out money now and say, let me just go to the hospital. It's very expensive. So in order not to stress people and to diminish out-of-pocket expenses, the best way to go about it is through the National Health Insurance Scheme.
As an HMO, Aisha speaks further on the impact of the NHIA in Nigeria.
Truly, it's a wonderful scheme. If only it can trickle down to the grassroots, it will really help. Just imagine if everybody in the country need to pay just 500 naira per month. That's a large sum of money. If we're able to pull that resources together, I think we can use it to carry our healthcare to the next level. So if HMOs can market these products that NHIS have and people key into it, it will be a wonderful idea to the NHIS.
Aisha also gives the perspective of HCL International as a partner with the National Health Insurance Authority.
We started partnering with NHIS right from inception, that is in 2005. We're one of the initial HMOs that were registered under the scheme, HMO 004. So, and my perception about the scheme is that, you see, accessibility, some people that registered under the scheme couldn't afford to do some form of surgeries or things like that. But with this scheme, they are able to do that. They are not only accessing government-owned hospitals, they are also accessing private facilities where they can go and get whatever they need to be, whatever service they request for to be done. And then the referral is across board. You can be referred to even a hospital in Sokoto, or from Kano you can be referred to a hospital in Sokoto or Abuja or wherever, and so people can be referred to hospitals like Aminu Kano Teaching Hospital in Kano, where they can get some services done. What we do is that we serve as intermediaries between the NHIS, who are our regulators, the enrollees, and the hospitals. So basically, what we do is that we carry out NHIS functions. So just like the way the banks carry out the functions of the CBN to the population, we make payments to the hospitals, timely payments to the hospitals on capitation and fee for service. We do referrals, timely referrals. We make payments to, we make sure we do quality assurance to the hospitals, and we do sensitizations to enrollees, and we market the health insurance to the populace too.
On the partnership between the health maintenance organizations and the healthcare providers, Aisha offers this explanation.
Even the teeth and the tongue quarrel. So I cannot say it's 100% rosy. Yes, we have issues with them, especially when it comes to payments. So, but we usually sit down, reconcile, and verify, and pay them their money for any outstanding claims they say we're owing them. So it's not bad, but it can be better.
Aisha further commends the introduction of the NHIA reconciliation exercise between the health maintenance organizations and the healthcare providers, saying that it has helped to address many issues.
In fact, that's a beautiful idea that the NHS introduced, because the hospitals are able to get most of their claims out, and then relationship is strengthened between the NHIS, the HMO, and the hospitals, and the scheme runs as should be, because nobody will want to run on a loss. So the scheme, the reconciliation is a very good thing in ensuring that payments are made to the hospitals by HMOs.
In conclusion, Aisha suggests ways that will help the authority achieve its mandates.
I will plead to them that they should make sure this scheme spreads. Awareness is made is better than what it is, and more people key into the scheme. All sectors in the country need to be able to access this scheme for us to have the universal healthcare coverage. Without it, if we don't spread, I'm sorry, the scheme might just be for a particular set of people. But if awareness is made better.
That was Aisha Bajason sharing her thoughts as a stakeholder in the health insurance space. Up next, your questions answered. Please keep watching.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
What are the channels of complaints for enrollees?
Okay, like I mentioned earlier, the routes of transmission. They can either walk into the office, that means they come in person, and we have offices across all the 36 states of the Federation. They can write. If they write to the Director General at the headquarters, it will eventually go back to their states. Like I said, they reside in a state, the facility is in a state, so we have a state coordinator. So they can write directly to the state coordinator by post, maybe hand delivered, or they could write through email. They could make telephone calls to the call center or the telephone numbers of the state office, and then through our social media handle, Twitter. Now we have a YouTube TV, and then sometimes even when we hold events, workshop and seminars, people come up and they lay complaints. So all of these complaints are actually collated, and we have what we call a monthly enforcement register. You know, that even from the state offices, they send to us over here. You know, so those are mechanisms that we've put in place to ensure that the complaint handling system of the authority is intact.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
And so, we draw the curtains on this week's episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIA and letting more Nigerians know that they can enjoy social health insurance, especially the vulnerable, as it has been paid for by the government. Find out how and get them enrolled too. See you next week.